This is the Medical College of Wisconsin's oral history project. I'm Dick Katchke, the chief historian, and today is September 21st, 2016, and I'm talking with Dr. David Warltier. And Dr. Warltier is an alumnus of MCW, both in the medical school and the graduate school, and he is currently the John P. Campine Professor and Chairman of the Department of Anesthesiology, and also a professor of pharmacology and medicine. Dr. Warltier, let's talk about what led to your interest in the first place in going into science and into medicine.
So I had always been interested in science and medicine ever since I was really a boy. But what got me ultimately on the right track was after I had graduated from Carroll College and I needed a job. So I worked at Aldrich Chemical Company as a research chemist doing organic synthesis. And at that time, I met a pharmacologist who was from Walter Reed, and we were making anti-malarial drugs at that time, which was an important effort during the Vietnam War. And he just really intrigued me, his background, what he was accomplishing, what we were trying to do working with Walter Reed. And he suggested that I might look into pharmacology, which I had no idea about, pharmacology as a career. And this man had both an MD and a PhD. So shortly thereafter, I went and visited the Medical College of Wisconsin, the newly named Medical College of Wisconsin.
So this would have been in about 1971 then?
This was, it would have been 1970. And I met a person that was extremely important to my career at that time, Harold F. Hartman. Harry was, turned out to be an icon in his field, pharmacology. He was president of the American Society of Pharmacology and Experimental Therapeutics, and he was also president of Federation of the American Societies for Experimental Biology as well. So a true icon that was very kind to me. He recognized what I wanted to do, and that was to get a PhD and an MD, and he helped me a great deal. Not only supportive in his thoughts and his ideas, but also supportive as far as financial resources for me as well. So that, I think that step, and it was a big step because I was going to take a big salary cut here from Aldrich to be starting in graduate school. Mm-hmm. But it was all due to Harold Hartman.
And who were some of the other faculty members back then? Now, back then it was just pharmacology. It wasn't pharmacology and toxicology
Excellent
yet,
point. Excellent point. Nope.
Mm-hmm.
There was no toxicology
Yep. Mm-hmm.
as of yet. And but Harry had assembled a great group of scientists, many from University of Michigan, where he trained. And, I can remember the man, one of the many that I really was close to was Dean Calvert. Harris Friedman was another, John Leach. But he brought in someone new. And so I had been there now. I started in 1971, so he brought this person in 1972 or three, and it was a cardiovascular pharmacologist who had superb training with both Eric Feigl at the coronary physiologist at the Washington University, University of Washington, and also Martin Winberry, who was in the pharmaceutical industry. I trained with both those individuals. He was a brilliant guy, and I don't think, Dick, I don't think there has ever been a better mentor, maybe some just as good, at MCW, but he was right up there.
And this is Garrett Gross.
And this is Garrett Gross. Wonderful, wonderful person. So Garrett became my mentor. We studied the regional distribution of myocardial blood flow in the heart under certain physiologic and pathophysiologic conditions. And he taught me a great deal. One of the things he taught me was, and I can remember this clearly, David, don't take yourself so seriously. So he not only taught me about, I guess, experimental biology and cardiovascular disease, but he taught me about life as well. He's retired now, as you know, and enjoying life down in Kentucky on a farm with his wife. Another icon in his field. He won some huge awards. One of the biggest ones that is given by the American Heart Association. So another.
And he was making contributions to the field to the very end of his career here, wasn't he?
Yeah, absolutely. Garrett just kept. Garrett helped me get my first NIH grant, and he was very successful in obtaining grants, and right up until, he could have obtained one the day he retired, and there was a big difference between early 70s and getting an NIH grant.
That's right.
And later on, and the approach to experimental biology had changed dramatically during that time, from whole animal approaches to molecular approaches, and Garrett just adapted to that wonderfully. Yeah, brilliant scientist.
Now, while you were in graduate school, did you also start medical school, or did that
Yes.
come after? So you were in both of them.
Yes. So there was some overlap there, and I was taking some, and by Harry Hartman's good graces, I was able to do that, and Harry actually helped foot the bill a little bit. So yeah, wonderful opportunity. Interestingly enough, I recall the very first time I met my other real mentor, John B. Campine, and it was in 1971 where I met him. After a lecture, he had stopped by the second floor of the old Marquette Medical School where we were at still, and to visit some of the faculty in pharmacology, and we started to talk. He had just given a fabulous lecture, another MD, PhD.
Yeah, I was going to say he was an MD, PhD as well.
That's right. And I think a lot of the stuff that we're touching on has to do with physician scientists and how I perceive physician scientists. But yeah, John had just given a lecture. I was at the lecture. It was a fabulous lecture on the heart, all aspects of the heart. It was over a couple of hours. He was just a wonderful speaker, huge man. He was, and he asked me, he asked me to come and visit his laboratory, which I didn't. Well, not right then, but about 10 to 12 years later, I did visit his laboratory.
Okay.
We can talk about how that
Sure.
that happened. But just another true icon in his field.
Now, with the background that you had working in pharmacology and studying there, did that give you a leg up in medical school? Did it help you because of the background you already had in the basic sciences?
Yeah, certainly it did, and what it enabled, because of the problems that we were studying in the research lab, I was able to relate those to clinical conditions, maybe easier than somebody else would have, been able to do. But we were studying coronary artery disease and blood flow in the heart and pathophysiology of coronary artery stenoses, and finally pharmacological agents that could improve the disease state. Yeah, I would say that definitely gave me an edge.
Why anesthesiology? With the work that you'd been doing in pharmacology already, could have gone into cardiology, could have gone into cardiothoracic surgery.
Yes.
What was it about? Was it the campaign, engagement, or what was it that made anesthesiology the field you chose to go into?
So that was certainly part of it. Part of it was that I could, transfer everything that I had done in the research laboratory to anesthesiology easily, because basically anesthetics, if we were going to study those, were another drug.
Yeah.
And there was also, John and I had a similar vision, and the vision was that an anesthesiologist just doesn't study anesthetics, that a real scientist in anesthesia would study physiology, pharmacology, pathophysiology, as well as the impact of anesthetics. And John really liked that idea, and basically had his career centered around that conceptual structure.
Now, was Dr. Henschel still around at that point? He had been the chair before Dr. Campine.
That's right. So Ernie Henschel was around until the late 70s, and then John took over from Ernie
Yeah.
in 19, and I believe it was 1979.
Mm-hmm. Mm-hmm. And did Henschel have that same vision, or was this something that was really sort of, developed by Campine?
I think Henschel had that vision, but Campine really moved on it. I mean, he created a department that was like no other in the country. He hired as many physician scientists as he could. He blended those with scientists in the laboratory so that there was crosstalk between clinicians and physician scientists and the basic scientists. It was masterful.
Well, and as you said, this was a department unlike other anesthesiology departments nationwide, in that
Yeah.
it had a tremendous research commitment that you really don't find elsewhere. In fact, MCW's anesthesiology department is consistently ranked in the top 10 for NIH funding for anesthesiology.
Yes.
And it's a tribute to the work that the leaders in the department, including you, have made to the field.
Well, I don't know, John. I would say that if someone really should get the credit for that, it should be John. He started this thing. Part of it was his own training. He not only got his MD and PhD here, but then he trained took a postdoctoral fellowship at the NIH, and came back and was, and Ernie, and once again, he was given the opportunity by Ernie to really put this together, and he just continued on. An interesting fact that the American Society of Anesthesiologists, one of the biggest AMA affiliate organizations, I think it may be the second largest, somewhere between 45 and 50,000 members. Each year, they select an individual to receive the Excellence in Research Award at the annual meeting. 3 people from our department have won this award. John Campine, I was second, and Jelko Bozniak most recently was the third. So no other department has even come close to that. So it's once again, it's a testament to vision, what we believe an academic department should be doing, and have multiple missions, and none is really more important than the other. I mean, education of medical students, residents, and fellows certainly is key, but I think research, patient care, all these are just
So it was a no-brainer for
important.
you to do your residency here in anesthesiology after you finished medical school then.
Yeah. It was a little tricky though. There was so I was very successful. Part of it was the timing, as we talked about before, about getting NIH funding then, and so I didn't do a residency for 4 years. I was in the pharmacology department, and I continued to work with Garrett. We were a team, very successful, but I did miss that clinical piece from medical school. I did miss that, and it gnawed at me. I wanted to do that, and ultimately, one of my best friends, Bill Schmaling, also an MD PhD in the Department of Anesthesiology, said, "You have to talk to John. You have to talk to John." So this is what I'm saying. I did visit him then 12 years later or whatever it was, after I first met him, and he said, "Yes, you should come into my department." And interestingly, as a resident and as a faculty member. Had to be an adjunct faculty member, but I still had multiple NIH grants at that time.
Yeah.
So,
another opportunity for a resident to be holding an NIH grant.
Yeah, it was unusual.
Yeah.
But once again, here's an icon in the field giving someone opportunity. So he's a wonderful mentor. Mentored me in a lot of different ways. Mentored me in leadership, and just a wonderful man.
Now, backing up, when you were a graduate student here, you had a special honor that you received. In 1976, the medical college was then located on the Marquette campus, but groundbreaking was here for the new medical school. And you were selected as the graduate student to use one of the shovels, correct?
Yes, I still have that shovel, and was right in front here somewhere. Maybe it was closer to where Joe's office, Dr. Krishna's office, is right now. But yep, big tent. Mm-hmm. I can't even remember the people that were there. Well, I remember Ron. I'll tell you, Ron Cornelius was there because I was sitting next to Ron, another wonderful leader of our medical college.
Kept us solvent.
He did. He was You know, we've had some great leaders there too, Doug Campbell and Ron, Alan Bolton, now Chris Copps. Yeah, yeah, it was quite the honor to do groundbreaking right here on the campus.
Wow. Now, after you finished your residency, when you joined the faculty when you were in pharmacology, before you finished your residency, you stayed on here at MCW, and your appointment in anesthesiology as a faculty member was about 1980, if I remember correctly. Somewhere in
Somewhere in that somewhere in that range now. I think now.
What was it like making the change from being a resident to now being a teacher, being one of the faculty members? Is there a change at that point? And were there others besides those we've talked about that helped mentor you and that collaborated with you when you became a faculty member then?
Yeah, it's a really interesting question. I think that lots of folks during my residency that were on the faculty, that were faculty members in the department, and that weren't doing research necessarily, but they were doing excellent patient care. Those folks gave me a lot of leeway. A lot of people helped me, Dick, and they gave me time, right, that other residents wouldn't receive. And there's so many, who can even mention them. But the transition afterwards to a faculty member is always a little bit tricky. One day you are in the operating room and being supervised, and the next day you're not. So it's always a little tricky. But John once again gave me an opportunity. He said, "Dave, you just have to be in the operating room 2 days a week. Take regular call, but the rest of the time you should devote, to research in your laboratory." And so that research component was a stable entity throughout my residency, and then afterwards too.
Now, was your lab here in the Basic Science Building? Was it over at the VA? Where were you located?
Well, that's kind of interesting. The anesthesiology research had 2 locations, as you point out. One was over at the VA, and the other was at the medical college. My laboratory was really in pharmacology and continued to be in pharmacology for some time. I would say, certainly during my residency, continued to be in pharmacology. But then we moved actually into the basement next to the Animal Resource Center here. Yeah, so we were there for a while. It was a very, very nice suite of laboratories, not only for me, but for other members of the department. At that time, Jelko Bozniak moved his laboratory, which was right next to mine, here from the VA.
Now, at that point, Milwaukee County Medical Complex was the major hospital on campus. Shortly after you joined the faculty, or during that time, Froedtert Hospital opened up on the campus, and VA was still one of our major clinical partners. On the clinical side, where did you work, or did you work in all of them?
Yeah, so I worked at all of them, but I spent time during my 2 days a week doing elective cases at the VA hospital. And then at night, most of it was in the, at Froedtert or at the Old County Hospital. that had operating rooms that had just been remodeled, at least when I became a staff physician there. And so, and primarily I was doing cardiac anesthesia.
Now, shortly after your appointment to the faculty in anesthesiology, you were also named the vice chair for research, and you were really, I mean, John Campine elevated you very early in your career as the number 2 in the department.
Yeah, well, you know, I think, what can I say? I was lucky. I was lucky. He was a kind, warm individual. We had a close relationship, and we had, once again, similar visions. We worked together well because we had the same goals of where we wanted to go with the department, where we wanted to go with research in the department. I think John was a cardiovascular physiologist, and he was very impressed with my an independent research program from pharmacology that was coronary physiology and cardiovascular, other aspects of cardiovascular physiology as well.
Now, as you look at, as we go through the 80s into the 90s, who are some of the people? There were new faces, new people that joined the faculty. Did you continue to work with Garrett Gross and with F Hartman and with John Campine? Were there other faculty members that came on board that were your collaborators? And at the same time, what were some of the things that you were looking at, and what were some of the discoveries that your team, the contributions your team was coming up with?
So I think we had numerous students, research fellows, residents that would come and join us. It was a very interesting time. I think that, of course, by that time, Harry had retired, and Bill Campbell, who had been here, by the way, and I knew Bill well, in early 70s, working with Harold Itzkovitz, right, one of our renal physiologists and nephrologists. And so Bill had come back. Bill had now taken the chair here. And I continued to work with Garrett for a short time. But that move of my laboratory from pharmacology to the basement, just an elevator away, can do interesting things to
the dynamics.
The dynamic of two people working together.
Yeah.
And so we continued to work together on certain projects. But then I started to develop other areas of interest. And I would say of all, one was done with a fellow that had just finished her residency in anesthesiology at the University of Iowa. And she came here. She wanted to have a research experience. She had one already at University of Iowa in cardiology. She was an anesthesiologist. And she came here to work and basically take a position on our T32 research training grant, of which there were only at that time like 2 or 3 in the country, and we had one. So this is Dr. Judy Kirsten. She just recently retired, and brilliant young investigator, really excited about what she was doing. I can remember saying to me that I really want to work on the impact of diabetes and heart disease. I said, forget about it. We're not going in that direction. Of course, a decade later, it turned out to be very important, and Judy made some big discoveries in that. Now, in hindsight, but hindsight's 2020. But
Well, go ahead.
yeah, but anyway, Judy. So Judy got to work in an area that intrigued me. We had noticed in the operating room that we had made a switch, and this is a national approach to cardiac surgery, that less and less opioid was being used and more volatile anesthetics were being used, and it all had to do with financial resources, hospital resources, and so patients would stay for less days in the intensive care unit with this new type of anesthetic approach. Well, one of the things that we noticed was that far less patients got episodes of ST segment depression indicating that they were having an ischemic event.
Mm-hmm.
Far less. We observed that in patients. These are patients undergoing cardiac surgery before the coronary grafts are put in. Far fewer. And so we took this into the research laboratory to study. And lo and behold, that volatile anesthetics reduce the extent of ischemia and reperfusion injury to myocardium. And Judy made that discovery. It was the first paper published in that area, and it was remarkable. It opened up this huge field in anesthesia. So many investigators worldwide entered that area of investigation. But Judy, as you know, became my senior vice chair.
Sure.
After a number of years, she was president of the faculty council, and just a very, very important individual to MCW.
Well, in fact, it's interesting in that one of the hallmarks of your department, both under Dr. Campine's leadership as well as your own, is that you recruited and helped grow female researchers, female faculty members then as well.
So yes, so I'm glad you mentioned that. I am very proud of that, and it's funny how a lot of this occurred, but right now, approximately half our faculty. At one time, it was 51%, but now I think it may be 50 or 49. I don't know. It changes.
Sure.
Someone leaves. Are women, and it's a big department with near 135 staff physicians or faculty, and another 120 trainees, physician trainees. But the leadership group that I have for different areas, 80% are women. Strangely enough, it's not by any particular design. You went for the best, and that's what we got. So yeah, I think women are we were lucky both in research and in other areas with our women faculty.
Now, when Dr. Campine made the decision to retire, as chair of the department, you were then selected to head the department. What's the change like when you go from being a vice chair and being part of the faculty to now actually running the department?
Yeah, it's interesting. I would tell you that I was acting really in taking up a lot of the work John was dishing off to me, the last few years of his chairmanship. But I just was naive at how much time and how much energy and effort being a chair would take, and how that would diminish the time that I could spend in the operating room or in the research laboratory, and now really I had to live vicariously in a way through younger people
Sure.
in the laboratory. But you know, isn't that what a chair is supposed to do?
Yeah.
I mean, I don't know, live vicariously, but
No, but-
certainly to have his younger people be successful and give them the opportunity that he had. And still today we're doing that. We have faculty that are MD PhDs, and we young faculty, and we have some trainees that are MD PhDs. Actually, several that have been through our MSTP
Sure.
as well. So
Now, we talked about Dr. Kirsten, talked about the fact that you had mentors, Drs. Hartman, Garrett Gross, and John Campine. On the flip side, you've had the opportunity to work with a lot of graduate students, a lot of our residents, people in fellowship programs, young faculty members. As you've helped them carve out their careers, I'm sure you're proud of them all, but who are some of them that come to mind that have really gone on to establish solid careers and contributions to the field?
well, I would say Judy, as we mentioned before, Judy Kirsten, who just recently retired, interestingly enough, is by far the most significant, and just another just very creative scientist who, by the way, moved with the field. Once again, as the techniques changed, Judy was able to adopt, modify her approaches to her experimental design in the area that she was studying, and that's what really made her successful. She went on. She was head of study sections at the NIH, and just really, I think, had a wonderful career. There are some others. One that's presently in the department, MD PhD again, Paul Pagel. He's head of cardiac anesthesia, and Paul, in his own right now, helps younger faculty with their papers, and he's primarily clinical, but he is one of our outstanding teachers. The residents love him. There are a couple, but I've had some interesting folks come through the lab.
Now, your department, under Campine's leadership, under your leadership, has always been known for the contributions and its leadership in the whole field of cardiac anesthesiology, heart work. But one of the other things that really has grown since you've been the chair of the department has also been pain research as well. Tell us a little bit about the growth of that component of the department.
Well, I think, Dick, I got to tell you, some of this is just, it's all about people.
Mm-hmm.
And it's all about who you hire and who you can, so as far as the overall pain program, we have a new vice chair for pain medicine, Rob Hurley, who's absolutely
You
brilliant.
recruited him from Florida, if I recall.
You're right. Once again, you know more history about my department than I do, I think. But Rob is a wonderful leader. He's part of this dose of reality and trying to push down the use of of opioids in patients with chronic pain syndromes, and he's doing a very nice job. His but you know, on the research laboratory side, there's Quinn Hogan. Quinn is a remarkable professor, I believe. I just his research in chronic pain syndromes and how to approach them therapeutically is brilliant. Once again, we're lucky to have these folks in the research laboratory. So, you know,
Now,
it's all about people.
Yeah, well, in talking about people, we've had a number of people in the Dean's Chair since you've been involved. Dr. Lennon, Dr. Cooper, Dr. Dunn, Dr. Ravden, now Dr. Kirshner.
Yes.
How does the Dean play an influence and help grow a department like yours?
Well,
As you've been able to observe their leadership over the years.
yeah, deans are key. Deans are key for a chair, and they have to have a similar vision, or you as a chair have to articulate that to the dean, who has to agree. And you know, Medical College of Wisconsin's been blessed with some great leaders. You know, you mentioned Ed, wonderful man. But Buzz Cooper was a interesting scientist in his own right, and there was a period, interestingly, in the 1990s, where a group of physicians in California, mostly made of internists, I hate to say, but they got together and they were examining the potential changes in the workforce for the future, and they came up with some conclusions. And their conclusions that anesthesiologists, and radiologists, and cardiologists were being overproduced, and the reverberation was phenomenal. Within just a couple of years, the number of residents went from, across the country, went from about 1,500 to 750. Yeah. Programs didn't fill whatsoever. It was unbelievable. And of course they were totally wrong. Their assumptions were incorrect.
But
and
in fact, and the problem was other organizations bought into it. The AMA, the AAMC, the government.
The
yeah.
federal government,
Yeah.
absolutely. Well, one person didn't buy into that. It was Buzz Cooper. Buzz Cooper wrote a paper at that time refuting everything that this group had come up with, but it was too late. The damage was done, and there, if you do some analyses, you can see we still haven't recovered from the 4 or 5 year period where we had really very few people entering this
In fact, I
specialty
can
field.
remember AAMC at the time actually, challenging Buzz and really,
Yes.
denigrating the work that he had done.
Yes.
And finally, in the late 1990s, I recall, they had a session at one of the annual meetings of the AAMC.
Yes.
And it was entitled, "What if Buzz is right?"
Is that?
That's right.
Well, that, how interesting is that? But yeah, a dean has to have a vision, or a chair and dean have to have similar visions, or else it's just going to be a disaster. And we've been lucky enough to have that. True academic deans here.
Sure. Now, as we look back, you started here. We talked earlier, and you were telling me that even before you started graduate school and medical school, you worked on the campus and the psychiatric program back at the county psychiatric facility. But when you started, you were on the Marquette campus. You've seen this campus grow. You've seen this institution change. How has it changed? When you look back at what MCW was when you first became engaged here and what it is today, what are some of the significant changes that you see in the institution?
Geez, it's just so. But let me give you an overall 50,000 foot view perspective on this. We were tiny. I mean, if you go back to Marquette University and what piece of Marquette was housed by the medical college, just the administrative wing, right? It was like 4 or 5 offices on the first floor, and it was tiny. And even when we moved out here to a wonderful new facility, it again was very, very small. I mean, you could have a tremendous amount of research going on just between the Allen Bradley building and some of the 6 floors here. So it's astounding when you look at and if you've been here any amount of time and you look at the aerial photographs that are taken of our academic medical center, it's just remarkable on how dense this has grown, this small area, and just filled up with buildings. It's really, I don't know, it's incredible. Our medical school is a large medical school. Class of 205 that is good size.
And that's just in Milwaukee. That doesn't include the 50 students on the regional campuses.
Yes, look at this. I'm getting forgetful that we just had. That's exactly right. That doesn't include that. So, yeah, no, it's amazing, I think.
Well, now the flip side. What's the same? What is there about the culture, the personality, the DNA of MCW that continues today? What is there about the institution that you found existed here back in the 70s that is still part of who we are?
Yeah, it's all about relationships and people working with each other, and that friendliness, that closeness, that really hasn't changed at all. There may be different people, but I think they're quickly assimilated into the culture of MCW, and that's one of, we used to call it the MCW family. And because it was a family. We were close when we were small, and there are more people. Some of the folks, we are so big that some of the folks you don't even know who they are.
Well, your department alone is so big. I mean,
our department has grown immensely, actually. Mm-hmm. But it's like I said, all about relationships and enjoying who you're working with.
Now, one of the things I forgot to ask earlier was, during your tenure, we added a 4th floor to the medical education building, and it created new laboratory space for the Department of Anesthesiology as well as the Cardiovascular Research Center.
Yes.
What did that new space mean to the department?
Well, it meant a great deal. This was a place where we would have all our, rather than being spread out, now we could concentrate. Investigators could be near each other to interact, and that's where a lot of ideas are ultimately generated from people doing different things, different approaches, with their laboratories right next to each other. But part of that, of course, we thank Mike Cudahy, still to this day, wonderful donor to the medical college, and a personal friend, by the way, of John Campine, and John had. And I've heard Mike Cudahy tell the story, as well as John telling the story, about the development of the first ST segment change monitor for intraoperative use. And that was an idea that came from people in this department. Mike rode that at Marquette Electronics and successfully, and he never forgot that.
He remembers. That's the great point.
He does remember. I can remember giving him a tour of the anesthesia side, right, of the research laboratories. I was walking with him. There was quite a large group of people, and as we were walking past the research laboratory, people were kind of behind us. So I thanked him, personally. I just said, hey, I just want to thank you for this is just a wonderful thing. And he looked at me and he goes, oh, well, you can't give it all to your kids. So a real, a real character as well as, very bright entrepreneur.
You've had a long career here at MCW, and you've made a lot of contributions to the field of anesthesiology, to the leadership that was needed for the institution, to the mentorship of new careers. What do you want to be remembered for?
I think what we talked about a little bit, and it's about giving people the opportunity, resources, time to be successful, and letting them do just that. And I can't think of anything more special than that, because those people, of course, they will remember, and they will, just like I remembered, they'll remember, and when they become leaders in the field, they'll do the same thing.
These are exciting and challenging times. Over the last few years, we've seen tremendous growth at MCW, both in terms of our geographic reach, expansion into Green Bay and central Wisconsin with new campuses, the development of new academic programs, the Master's in Anesthesiology Assistant Program, the development of a School of Pharmacy. These two programs alone touch on your career.
Yep.
What do you see as the future for MCW?
Well, John Raymond came here, from Medical University of South Carolina, a school that really had all kinds of allied health programs, over which he resided, by the way, as in his position there, and that was his vision. Wonderful president, and I believe the Medical College of Wisconsin, which has a tough issue as far as branding. How do you change that name? And you remember what happened with the Marquette University alumni, and then going to medical college. But John's vision is spot on, and allied health is the future of the Medical College of Wisconsin. There's no question about it. And hopefully some of these programs will grow. Ours is growing already. We were going to take 10 students. We took 12. So, and they're outstanding as far as this anesthesiologist assistant program.
And what will pharmacology, or a School of Pharmacy mean to pharmacology here, to anesthesiology? How do you see that as an adjunct to the other work that's going on?
Well, I think that the pharmacists of the future, that they are the vision for our new dean of that school, is to really create an individual that works side by side with physicians in the hospital, and it's not the pharmacist that we may think of, when we go to get our prescriptions filled, but a very different type of individual, far more intellectual and far more important as far as day-to-day patient care.
Very good. I want to thank you, and thank you for all the contributions you've made to MCW over the years.
It's,
Truly appreciated.
well, I'll just tell you, I'm just lucky that I think that Harry Hartman started it off, and that folks have allowed me to be in my position. So.
Great. Thank you.